So Salman, you can take the lead.
So I'd request Afifa Afsar, who's my senior resident, to start the talk. Afifa, can you please open up your video too? Thank you.
Hello, everyone. Can you hear me?
Yes, we can. We can start.
All right. So the topic that we'll be discussing today would be cerebral anatomy of the frontal lobe. And so without further ado, we'll be starting. So as we all know that all the hemispheres of the brain basically have certain surfaces. So we have basically a lateral surface, a medial surface, a superior view, an inferior view, which is also called as the basal surface. So to begin with, we have the lateral surface, and the lateral surface of the frontal lobe primarily
Your slides are not going forward, so maybe you just need to first of all do a
presentation mode.
Yeah.
Is it?
If you can make it first in the full screen mode, because now we see the PowerPoint. Screen,
Just
but we
make
don't
on
see it in
presentation
full-
mode. Yes.
Yes.
So if you click below that,
Mhm.
no, the presentation mode is down on the right next to where it says 81. Yeah.
Yes.
Yes, yeah.
Yeah.
Yes.
Is it okay?
No, it's still not there.
Maybe if you can
Maybe-
exit the screen sharing and share again.
Please share again, and that would work again. So exit the screen share, and then, yeah, that's better.
Yes.
So
Excellent.
yeah.
All right. So we were talking about the lateral surface of the frontal lobe. And when we talk about the lateral surface, so the primary three structures that we appreciate on the lateral surface of the frontal lobe include the superior frontal gyrus, and then we have the middle frontal gyrus. So the superior frontal gyrus and the middle frontal gyrus are separated by a superior frontal sulcus. Then we have the inferior frontal gyrus. So the middle and the inferior frontal gyrus are basically separated by an inferior frontal sulcus. So on the lateral aspect of the frontal lobe or the cerebral hemisphere, if we talk about the frontal lobe, so we have primarily two sulci constituting the frontal lobe and three primary gyri, which is the superior, middle, and inferior. Then coming to the inferior frontal gyri, we basically have three prominent parts. So we have a pars orbitalis, which is going to be covering the overlying orbital roof. Then we have a pars triangularis. This is the inverted triangular structure that we can appreciate here. And then we have a pars opercularis. So part of the pars opercularis and triangularis primarily constitute on the left side of the brain, the primary motor speech area. So this is the primary aspect that we can appreciate. Also going further, extending posteriorly, we can appreciate that this is the central sulcus. Anterior to the central sulcus is the whole of the frontal lobe primarily, and we have and we can appreciate that the central sulcus is one of the sulci which does not meet the Sylvian fissure completely on the lateral aspect. So anterior to it is the precentral gyrus, which is the primary motor strip, and posterior to the central sulcus is the postcentral gyrus, which is the primary somatosensory cortex. So this is about the lateral surface. Then going on to the anterior view of the same. So we can appreciate when we're looking at from the top. So we can appreciate that there is an anteriorly, we have the frontal lobe, frontal pole, and primarily we can see that this is the superior frontal gyrus, again, being separated from the middle frontal gyrus via a superior frontal sulcus, and then we have the inferior and the middle frontal gyrus being separated by the inferior frontal sulcus. Here we can also appreciate on the lateral aspect the Sylvian fissure and the temporal pole and the temporal lobe that can also be appreciated. So this is basically, I'll take you through different views of the cerebral hemisphere in order to get yourself acquainted with the fact that how the lobe is going to look like from different views. Then you have a superior view again. So we're looking right from the top. So we can here now appreciate anteriorly we have the frontal pole and posteriorly we have the occipital pole. And dividing the two cerebral hemisphere, we have the longitudinal cerebral fissure that we can see in the midline. So again, just towards the vertex on the topmost area is your superior frontal gyrus. Then again, it is separated from the middle frontal gyrus by a superior frontal sulcus. Then we have the middle frontal gyrus, which we can trace all the way. And then middle and the inferior frontal gyrus is being separated by the inferior frontal sulcus. So again, revising it. So we have 2 sulci and 3 gyri that primarily involve the frontal lobe. Then this is, as we were talking about, the inferior or the basal surface of the frontal lobe. So we're looking from the inferior aspect. So here we have a different anatomy. So the medial most aspect is basically the gyrus rectus. And the gyrus rectus is actually separated from the orbital gyri via an olfactory sulcus. So why is it called an olfactory sulcus? Because basically olfactory nerve roots, they actually travel in between this. And posteriorly, these olfactory basically they divide into the medial and the lateral lamina. Then we can also appreciate that on the inferior surface, lateral to the gyrus rectus, we have this orbital gyri which are present. And further, when we go towards the cadaveric views, I'll be able to tell you. So basically, we have the medial orbital gyri, posterior orbital gyri, inferior orbital gyrus, and we have the lateral orbital gyrus. Basically, this basal surface of the frontal lobe is going to be constituting about the orbital gyri and gyrus rectus. Coming to the medial surface of the frontal lobe, so we trace the superior frontal gyrus on the medial aspect as well. So extending all the way from the basal, like the inferior most aspect, going over towards the top. So we have this is appreciated as the superior frontal gyrus. Superior frontal gyrus is separated via the cingulate gyrus, in between by the cingulate sulcus. And the cingulate sulcus, we can trace it back all the way. And this tends to go again towards the convexity as an ascending ramus of the cingulate sulcus, which tends to divide the paracentral lobule. But the paracentral lobule is basically a continuation of the pre and the post central gyrus on the medial aspect of the brain. And then we have posterior to the ascending ramus of the cingulate sulcus, we can appreciate the part of precuneus, which is again the part of the parietal lobe. So all the structure that is lying anterior to it is going to be constituting the frontal lobe. And this posterior to the ascending ramus of the cingulate sulcus, we basically have beginning of the parietal lobe. Now, coming from top to bottom, so we have the superior frontal gyrus, which is the topmost structure on the medial aspect. Then we have the cingulate gyrus. Both of them are separated via a cingulate sulcus. Then the cingulate gyrus is separated from the corpus callosum by a callosal sulcus. And inferior to it, we have a corpus callosum. Corpus callosum is basically going to be bounding the frontal horn as well as the body and roof of the lateral ventricle. So here we can appreciate that this is the lateral ventricle. This is the body of the corpus callosum. This is the genu, and the basal surface. The basal surface is going to be the rostrum of the corpus callosum is going to be forming the basal part of the frontal horn of the lateral ventricle. So this is what is of utmost importance here. Secondly, we can also appreciate here there is this para-terminal gyri and the para-olfactory gyri. So they are basically going to be just bounding the inferior most aspect of the rostrum of the corpus callosum. So this is basically areas which are right in close proximity to the interior perforated substance, and this you can actually appreciate on the medial most aspect or the inferior or the basal surface of the cerebral hemisphere. Now, this is the cadaveric section. So this is like a brief, quick, short kind of a review. So this is the lateral hemispheric surface that like we all can appreciate. And this is the famous Sylvan fissure that actually tends to separate the frontal lobe from the temporal lobe. And we can trace it back all the way back. This is the pre-central sulcus. Sorry, this is the central sulcus, because like I discussed earlier, that the central sulcus does not meet the Sylvan fissure all the way on the lateral aspect. And the gyrus that is going to be lying anterior to it is going to be labeled as pre-central gyrus. And the gyrus lying posterior to this sulcus is basically the post-central gyrus. So this is the sensory area and this is the motor cortex. Then we have the pre-central sulcus, which is basically the continuation.
Afifa, just 1 second,
Yes.
Ahmed. Afifa, can you unshare and share again, and then we can remove these things from the thing. And There's whoever it is, please do not write and do not, Ahmed, please do not allow anybody to be able to use marks. So whoever is doing it,
I don't
so
know how to
otherwise,
do that, so
so there's one of the Muhammads are doing it. So first name was shown there. So, but we can't remove all of them. So I think next time we see it, then we'll have to remove whoever it is.
okay.
Try not to disturb, please. Okay, you can restart, Afifa.
All right, so we were discussing about the pre-central sulcus, which we were talking about that basically, like we previously discussed, the portion of the inferior frontal gyrus. So if we locate, this was the pars opercularis on the inferior most aspect of the frontal lobe. So the continuation, the sulcus that is running just that we can trace it all the way towards the top is basically going to be our pre-central sulcus. And then we have the area which is posterior to it is going to be pre-central gyrus. And this is the central sulcus, which we can trace all the way towards the top again. And why we call it the central sulcus? Because here we can appreciate that this sulcus is the particular sulcus that is not meeting the sylvian fissure here. And this is relatively thicker as compared to the post-central sulcus. Also, the area... Hello? Yes?
Sorry, carry on. Somebody must have opened their mic.
Yeah, so the area that is beneath the central sulcus is basically called as the subcentral gyrus. So this is a small part of the lobe that can be appreciated, and this is going to be housing both the fibers, that is the area of the post-central gyrus as well as the pre-central gyrus. And that is why this is called as combinedly as subcentral gyrus. Yeah, next. So this is the post-central gyrus, like we could appreciate. This is the central sulcus, post-central gyrus, and this is the post-central sulcus. Then this is the area that we were talking about, that this is the frontal lobe. So we can see this is the inferior frontal gyrus, this is the middle frontal gyrus, and the topmost is your superior frontal gyrus as highlighted. Again, this is the superior frontal gyrus for all the beginners, so that they're able to identify. This only highlighted area is complete, just the superior frontal gyrus. Then coming here, so relatively thicker is your middle frontal gyrus. And then we come to the inferior frontal gyrus. Like we said, the area housing the orbital roof is pars orbitalis. The inverted triangle is pars triangularis. And then we have the pars opercularis. So these are the three components of the inferior frontal gyrus. Then we have the pre-central gyrus, which is the motor strip. Then we have the post-central gyrus, which is the primary somatosensory cortex. This is the subcentral gyrus, like I was talking about. That is the area beneath the central sulcus and having fibers or the portion of the post-central as well as the pre-central gyrus. So that is why it is called as the subcentral gyrus. Then we have a structure called as central lobe or paracentral lobule. So if you trace the pre-central gyrus as well as the post-central gyrus on the medial most aspect of the lobe, so that is labeled as the paracentral lobule. So here we trace, this is the homunculus of the brain, and this is going to give us an orientation that how the motor and the sensory fibers are oriented. On the medial most aspect, we have the area of the lower limbs, and on the lateral cortex, we tend to have the area of the hand, the body, and the face primarily. So the facial fibers are going to be lying further inferior, and then we trace them back. So they house then the primary hand area is basically the largest and which is present over the convexity, and then we can trace the homunculus back all the way to the trunk and the body. However, the lower limb or the leg area is primarily on the medial aspect. Again, this is just an orientation for the beginners that the primary motor cortex, that like we talked about, is constituting the precentral gyrus. So the homunculus is more or less oriented in the same manner for both the sensory as well as the primary motor cortex, depending upon the areas and depending upon the sensitivity of the areas, the area is involved. Now we have the premotor area. So part of the pars opercularis, that is the portion of the inferior frontal gyrus, as well as the middle frontal gyrus, is basically constituting the premotor area. Premotor area is primarily one of the areas which is predominantly involved in motor planning of all the activities. So initiation comes and planning primarily comes from the premotor area. So it's important to know that part of the pars opercularis as well as the middle frontal gyrus is the primary constituents of the premotor area of the brain. And then this is again a cadaveric section. So here we can see this is the Sylvan fissure. This is the inferior frontal gyrus. So again, quick review. This is the pars opercularis. This is pars triangularis. And then the area over the orbital roof is pars orbitalis. This is the inferior frontal sulcus separating the middle frontal gyrus and the inferior frontal gyrus. And this is the subcentral sulcus, like we can subcentral gyrus, that is lying just beneath the central sulcus and over the top of the Sylvan fissure. Then removing the lateral aspect of the brain, going towards the medial aspect to give an orientation. So here we can appreciate that the superior frontal gyrus can be traced back on the medial surface as well as the topmost entity. And then superior frontal gyrus is going to be separated from the cingulum via a cingulate sulcus. And then the cingulum is separated from the corpus callosum via callosal sulcus. And then corpus callosum, like we know, actually tends to surround the frontal as well as the body of the lateral ventricle. So it traces it back all the way till the splenium of the corpus callosum. This is a section with all the cortical branches that can be, this is again a lateral surface of the brain, and this can be appreciated that here we can see the superior sagittal sinus, which is running all the way in the midline from the frontal pole all the way back to the torcular heterophyllae, which is a confluence of sinuses. And also we can appreciate that these are the cortical branches, the venous as well as the arterial branches that supply the frontal as well as the temporal area, which are the branches constituting the anterior cerebral artery as well as branches from the middle cerebral artery. Then here we can appreciate, this is like we were talking about the superior surface. So here we can appreciate that on the middle, in the middle middle aspect, the superior of the superior sagittal sinus, we know, okay, on the central side we have various venous lacunae that are present on the either side of the sagittal sinus that can be appreciated. And here we can again trace the superior frontal sulcus and the inferior frontal sulcus, which is going to be dividing the superior frontal gyrus, the middle frontal gyrus, and the inferior frontal gyrus here. This is the posterior aspect, and here we can see the confluence of sinuses, and again the superior sagittal sinus that can be traced all the way back. And again on the convexity we can appreciate the superior frontal gyrus, then we have the middle frontal gyrus, and the inferior frontal gyrus is going to be on the inferiormost aspect. Coming to the medial hemispheric surface of the brain. So this is a cut section that we can appreciate. So here we have kept the area of the pre and the post central gyrus intact in order to give an orientation that what lies further deep to all these structures. So this is the fork cerebri, which tends to separate the two hemispheres, and we can appreciate that just deep to the post and pre-central gyrus, interior to it actually lies the frontal horn of the lateral ventricle. Like we discussed, that the frontal horn of the lateral ventricle is actually bounded all the way from the basal to the anterior wall, as well as the roof is basically bounded by portions of corpus callosum. So the basal surface is going to be bounded by the rostrum of the corpus callosum. The interior aspect is basically, anterior wall is being formed by the genu of the corpus callosum. And then the body of the corpus callosum tends to form the roof of the frontal horn of the lateral ventricle. And superior to the corpus callosum lies the cingulum. So both of them are actually separated in between via a callosal sulcus, and cingulum is again separated from the superior frontal gyrus, which is the medial continuation of the topmost gyrus on the medial aspect via a cingulate sulcus. So this is just an orientation for the orientation purposes. The deeper structures what lie on the middlemost aspect we are able to know and appreciate. And this is a similar picture. Again, we can appreciate here the cingulate sulcus. This is the superior frontal gyrus. This is the cingulum. This is the corpus callosum, and this is the callosal sulcus, which actually houses the pericallosal arteries. Again, like what we discussed previously, To give a brief overview, this is the cadaveric view. Here we can see this is the cavity of the lateral ventricle. This is again the corpus callosum. So like we said, like I told you, that the basal surface is being of the frontal horn of the lateral ventricle is bounded by the rostrum of the corpus callosum. This is the interior-most wall is going to be formed by the genu of the corpus callosum, and this is the body which is going to be forming the roof of the frontal horn of the lateral ventricle. Above it is going to be a cingulate gyrus, and the cingulate gyrus can actually be traced all the way to the inferior-most aspect and the basal aspect of the corpus callosum in the formation in the form of para-olfactory gyri and the paraterminal gyri, which basically lie in close proximity to the lamina terminalis. The down is going to be the lamina terminalis, which is going to be a continuation of the anterior wall of the third ventricle as well. Similar picture showing similar anatomy again. Then yeah, so this was an orientation in order to identify on the basis of radiology. So this is an MR cut section like we appreciate, and what is important to know, the primary most structure that we need to identify is basically the central sulcus. So here we see that there is a characteristic hand knob sign, which is characteristic of the central sulcus. The area that is lying anterior to the central sulcus is the precentral gyrus, and it's primarily the motor strip. So the significance of this hand knob sign or identification of central sulcus is important in order to delineate the motor cortex. And like we can say again, because it's a cut section, which is an axial section all the way from the vertex and right from the top. So this, we can appreciate that this superior most aspect is the superior frontal gyrus, and this is the superior frontal sulcus that tends to separate and that does not come in the midline. This is and the gyrus that is lying anterior to this hand knob sign is basically the motor strip or the pre-central gyrus, and posterior to it is going to be the motor cortex, which is the post-central gyrus. This is like a review. This is corpus callosum. This is the cingulum. So in between both of them is going to be cingulate sulcus, callosal sulcus, sorry. And this is the cingulate sulcus, which is dividing the superior frontal gyrus and the cingulum. This is the paracentral lobule, like we discussed, that it is the continuation of the pre and the post-central gyrus on the medial aspect of the cerebral hemisphere. Then this was the basal hemispheric surface, like we were talking about. So this is like the hemispheric, basically half of the cerebral hemisphere that you can appreciate. So like we talked about, the medial most aspect is gyrus rectus, and the gyrus rectus is separated from the orbital gyri by an olfactory sulcus. Why do we call it an olfactory sulcus? Is because the olfactory sulcus tends to house the olfactory tract, and the olfactory tract can be traced all the way back just anterior to the middle anterior perforated substance as lateral olfactory stria and the medial olfactory stria. So this is going to be housing the olfactory nerve roots, and that is why it is called as the olfactory sulcus. Lateral to the olfactory sulcus is the orbital gyrus. So this is the medial orbital gyrus, and anterior is the anterior orbital gyrus. Here is the lateral orbital gyrus, and this is the posterior orbital gyrus. So these all four gyri are actually separated by various sulci, which tend to have an H-shaped kind of an orientation. Like if we appreciate, so this is like an anterior part, this is the posterior part, and this is the lateral. So this roughly is going to be making an H-shaped kind of an orientation that tends to divide the orbital gyri, which are forming the basal-most surface of the frontal lobe into anterior, posterior, lateral, and medial. Again, like with the complete view. So this is the gyrus rectus. Gyrus rectus being separated from the orbital gyrus by an olfactory sulcus. The olfactory sulcus housing the olfactory tract, tracing it back, lateral olfactory stria and medial olfactory stria anterior to the anterior perforated substance. And here we can appreciate that this is the medial orbital gyri, this is the anterior gyri, this is lateral, and this is the posterior orbital gyri. Again, why this is important to know, because this is the basal-most surface, and deeper to it is going to be, if we trace the white matter tract, so deeper to it is going to be the frontal horn of the lateral ventricle, like we discussed, because frontal horn tends to it basically houses the frontal horn is basically the inferior-most aspect, and houses basically the inferior-most aspect of the frontal lobe. This is a similar picture, so we can see the cut section. This is the rostrum of the corpus callosum, which tends to form the base of the frontal horn of the lateral ventricle. Then we can trace the lateral to the frontal horn is the head of the caudate. And if we trace it back, so we have the lentiform nucleus, which is again going to be the caudate, and the lentiform nucleus is going to be divided by the anterior limb of the internal capsule. So this, when we go towards the core gray matter. Then coming to a brief radiological anatomy, because when we talk about frontal lobe, so the important radiology that we need to identify, like we discussed earlier on as well, is primary orientation of to how to identify the central sulcus. Why central sulcus is important? Again, because anterior to the central sulcus is the motor strip, and it is important that we are able to identify the motor strip so that we're able to identify the lesion. Then, depending upon it, the different different kind of deficits or different kind of neurological what do you call it, the neurological manifestations that the patient is suffering from, we're able to appreciate, and the areas of involvement. So here we see that this is the characteristic hand knob sign like we were talking about. So this is an axial section of the brain, and this is an MRI image like we can appreciate. So the hand knob sign is, why is it labeled as a hand knob sign? Because like we talked about earlier while we were discussing the homunculus of the brain, that the hand is the area which is present on the vertex, and it is represented as on the vertex, and this is primarily the area that occupies like a major chunk. So because of its orientation, that is why it is named after it, and it's also called as an omega sign because it's shaped like an omega, and or it is called as the hand knob sign. So the this is primarily the orientation or the representation of central sulcus on the radiology, and anterior to it, the gyrus that lies is basically the pre-central gyrus, which is constituting the motor strip, and the gyrus lying posterior to it is the post-central gyrus, which is comprising the primary somatosensory cortex. This is called the marginal sulcus. Why do we call it marginal sulcus? Because this is the continuation of the paracentral and the precentral gyrus when they are when they are reflected onto the lateral aspect. So this is the continuation of that. So here we can appreciate that this is the central sulcus, like we were talking about, that is highlighted with the color blue. Then we have the marginal sulcus. So the sulcus, sulcus lying anterior to the marginal sulcus is usually the central sulcus, and the gyrus lying anterior to the central sulcus is the precentral gyrus, which is also the motor strip. Also, we can appreciate that this is the superior frontal sulcus, like we were talking about, separating the superior frontal gyrus and the middle frontal gyrus. So the superior frontal sulcus tends to form a T-shaped orientation with the central sulcus. So if we see, this is the superior frontal sulcus, and this is the central sulcus. Again, so the area that is highlighted in the color blue is the representation of superior frontal gyrus. Then we have it being separated by an orange colored line, like we can appreciate. So this is the superior frontal sulcus, and inferior to it is going to be middle frontal gyrus, which is relatively whiter. Then we can appreciate that this is the hand knob or the omega sign that can be appreciated. So this is the precentral sulcus, and this is the precentral gyrus. This is the post-central gyrus. So these are the different signs which help us to identify the central sulcus on the MRI. So this is the pars bracket sign. So pars bracket or the marginal sulcus sign tends to orient that this the sulcus that is lying anterior to this pars bracket is the central sulcus. Then this is the cortical thickness sign, that the thickness of the gyrus anterior to the central sulcus is going to be more. So we know that the motor strip has a wider, it is relatively thicker as compared to the sensory cortex. So that is why it is called as a cortical thickness sign. Then we have the omega sign, which we discussed earlier on, and this was the T sign that I was talking about, that this is the superior frontal sulcus separating the frontal gyrus, superior frontal gyrus and the middle frontal gyrus, and tends to meet the sulcus that is lying anterior to the central sulcus. So this tends to form a T with the central sulcus. So the gyrus that's going to be lying posterior to the T is going to be labeled as the motor strip or the precentral gyrus. Again, this is the white and the gray sign that we can appreciate. So obviously, this is the area of gray matter, and this is relatively wider. Here we can appreciate anterior to the hand knob sign. So this is the identification and representation of motor strip on the MRI. Again, this is the same orientation like we see. This is also called as sigmoidal hook sign. It is also called as omega sign, and sometimes as a hand knob sign. Posterior to it is the pars bracket. So sulcus that is lying anterior to the pars bracket is the central sulcus. Here we can appreciate that the sulcus that is lying posterior to the central sulcus is obviously the post-central sulcus, and the gyrus lying anterior is the sensory cortex or the post-central gyrus. The gyrus lying anterior to the hook sign is the motor strip, which is the precentral gyrus. And here also we can appreciate that this is the superior frontal sulcus, separating the superior frontal gyrus and the middle frontal gyrus. And this is meeting just the precentral gyrus anteriorly in a T-shaped manner, representing this is the lying posterior to it in the representation of motor strip. This is the orientation on the medial aspect of the cingulate sulcus. So here we can see this is the cavity of the lateral ventricle. This is the corpus callosum, like we can trace. So the corpus callosum is being separated from the cingulate gyrus via a callosal sulcus. Okay, and the cingulate gyrus is being separated from the superior frontal gyrus via a cingulate sulcus. So this cingulate sulcus, like we talked about, is going to have a continuation as an ascending ramus on the medial aspect, and this the gyrus lying anterior to it is going to be the paracentral lobule, which is the medial continuation of the pre and the post central gyrus, and the area lying posterior to the ascending ramus is going to be constituting the precuneus, which is the medial aspect of the parietal lobe. So this is what we discussed earlier on as well. This is the color-coded highlighted aspect. This is we are tracing the cingulate sulcus primarily all the way on the middle aspect. This is separating the superior frontal gyrus and the cingulate gyrus, and then we trace the ascending ramus all the way towards the vertex. So the gyrus lying anterior will be the paracentral lobule, and lying posterior to it would be the area of the precuneus. Thank you.
Thank you very much, Dr.
Any
Afifa.
questions? Yeah.
Any questions? Excellent talk, Afifa.
Is there any question for Dr. Afifa on this great presentation? Any question? Let's see the chat. Let's see questions, but there is many compliments and comments. Positive comments of this nice presentation and very nice images and explanation of the anatomy. So thank you very much, Dr. Afifa, for this nice presentation. And also thank you, Professor Mann, for supporting the educational courses everywhere. And on behalf of the Yemeni Neurosurgical Society, I give you my deepest appreciation and gratitude for your support and your help for our educational course in the module 1 and this module also.
No, I think we owe it all to you. You do so much work. We are just there to support you whenever required. And it's wonderful that you have got excellent support with Narjiza there as well. So I think it's amazing. And I'm grateful to everybody who attended and learning so much. Like there are things that I was revising that, there are a few things that I didn't remember from last time, and it was good to go through this again. So it was wonderful. I think everybody, I'm sure, enjoyed it.
Thank you very much. And thank you, Narjiza, for your help also. And thank you,
Thank you so
Dr.
much.
Afifa, for this fantastic presentation.
Thank
Yes,
you, Emma, for having me.
Thank you. So I think, shall we wrap up? You want to have a group photograph or you want to finish?
Okay, we can try to take a group photograph. Let
Everybody
me
switch on their
figure out how to
videos.
do it.
So everybody
not,
switch on their videos.
Okay.
Dr. Salman, can you do it for me? I don't know how to do it. So
Yeah,
I'll
if
make you
there's
host,
no
and if
problem,
you can do it,
let's get some more people to come in as well. So please switch on your videos.
please, everyone open your video to take a group photo of the
Come on, let's have some more people.
attendance.
Okay.
Good.
Now we can take a photo, I think.
Right, good. So thank you very much. Let me just take a picture. Sorry, another one because there are more people joining. Okay. All right. Thank you. It was wonderful as always. Ahmed, great job. And thank you, Afifa, for that wonderful talk.
Thank
you
you
so
very
much.
much. And thank you for all attendance. And by this, we conclude our first session and first webinar of the second module of the comprehensive neuroanatomy educational program. And thank you, everyone, and see you next Friday, inshallah.
Inshallah. Thank you. Bye-bye.
Thank you.
See you all.
Bye-bye.